Hi guys, it's Diana
And Faly.
from the Mental Chat. It's been a while. We haven't been posting in, I want to say, like almost 2 years maybe.
Yeah, I think we were posting back in the pandemic.
Yeah, it was the pandemic, and then things just got crazy and weird for us. And then you have a new addition to your family, Faly?
Yes, I had a baby a year ago.
So it has been like over 2 years
yes,
since we.
because I was pregnant, we didn't post. I had a baby, I didn't post, and yes, now he's 1 year old.
Yes. So we decided to make this video because we want to get back on track with the Mental Chat and sharing information about mental health and resources in our experience. And this special or particular episode of the Mental Chat, we're going to focus on postpartum depression. And we're going to do things a little bit different, I think, from before, because before we both kind of talked about our experience, but I don't have a kid, I've never been pregnant, so I wouldn't know what kind of information to give you guys. So I'll be asking the questions and Faly will be answering. And you know, hopefully we get to know more about your story, and hopefully someone out there feels less alone or feels seen, because I know that postpartum depression is a serious mental health issue that I think not a lot of women talk about, or at least I've never really heard about anyone talking about it growing up. I don't know if you did.
But I've gotten different views on it. I've had people that didn't thought that wasn't true, that doesn't happen, how could you feel that way about your child or what have you, and I never really had a really good outlook on it. As far as what it meant and what it was about.
So I personally never knew anyone that went through postpartum depression. I know people that have been depressed or have anxiety or had suicide attempts, but it's never been postpartum. And so when you were dealing with it, and we'll talk more about it, it was the first time that I went through it as an outsider looking in, So it was weird for me because I knew that you needed help, but I didn't know how different it was from a regular person that didn't just have a baby, what the help that they would need. It was just a different situation or experience for me as well. So let's get started. I guess my first question for you is, with your history of mental health in the past, and we've shared it before in our previous videos, were you afraid or were you expecting to show any symptoms of depression or anxiety during your pregnancy? Is that something that you were afraid of?
Yes. So I remember I always told my husband, I was like, hey, we need to just be aware, because it's I'm prone to getting down. I've had depression multiple times, so I'm I know that this happens when you're pregnant, and it happens to many women. I actually was just really scared. I was really scared because I'm oh my God, this is gonna happen to me. I already had this feeling that I'm this is gonna happen to me. How wouldn't it not happen to me if I've already gone through depression at the past, and this is something that happens to women who after they had a baby. I was just very hopeful that it didn't. I'm maybe it won't, maybe it won't. I think what happened is that it wasn't the same. So I was very confused about it because it wasn't my perception of what it was going to be. So that made it even more difficult to identify what was actually happening to me, because it wasn't the same as everybody else.
So your pregnancy went fine then? You didn't really have any issues with your mental health? It was just normal stuff, would you say? No, I was so happy. So it's so funny because I complained a lot during pregnancy. Because it's I'm holding your child, I'm doing all this. I was bearing the load, but I had so much I don't know, happiness in me, and it was just all the burst of estrogen. I don't know what it was, but I was so good. I was so happy. My husband was why aren't you freaking out? And I'm we're having a baby. What do you mean? He's in me, and I'm all motherhood.
And motherhood. I was just so excited, and I didn't. So that's why I was okay, maybe I won't go through anything bad, because my pregnancy went fine. I had bad heartburn. I got really And I complained a lot about it. Like I was like, oh my god, I can't believe I have heartburn. But I was able to do everything. Like I was still able to go out and about, and then I just like slept when I could. Like so, and I was just happy, like looking forward to the baby, because then I'd check on him, like they do the ultrasounds, and I get excited about his little face. And
So there were like no red flags, like in
No.
your pregnancy, like
as far as because if pregnancy was an indicator I was gonna get postpartum, no.
okay.
No, I was like, my husband was having a hard time, but I didn't know. I was doing really good.
So up until giving birth, like you gave birth, how was that experience for you? And how soon after giving birth did things start to happen?
So my labor was good. I mean, I complained, like it was horrible pain. It was horrible. Like I did 24 hours of back pain. I went into the hospital in the morning. It was like 2 a.m. I told my husband I was having contractions, and we go early morning, and they have us walk. They're like, oh, okay, you're not dilated, so they have us walk in the hospital, and then they check me again. They're like, yep, you're gonna go home because there's nothing we can do for you here. So they gave me medication and they sent me home, and the pain was horrible. It was all in the back, but the medication helped. But then I came back and it was like 10 times like the worst pain in the world. And my husband was like freaking out. Like he thought I was gonna faint, like because I couldn't handle the pain. And they sent me back and they're like, no, you're not good enough. Like you haven't dilated. So they had me walk, and I'm just like crying from the pain. Like I remember it vividly. People are like, oh, it's a blur, you forget. I'm like, no, I remember it exactly to the detail of the pain. I remember the detail of the pain, the extent, every little moment. I remember just standing and hanging onto a rail because they made me walk, and I'm like, I can't do it anymore. And I told my husband, like, let's just go back. Like, tell the lady that I can't do it. It's fine. Just have them send us home. I don't care. Like, I'm not gonna walk. I'm not gonna keep walking. I can't keep walking.
Yeah.
So no, they checked me and they were able to take me in, and I asked, when can I get the epidural? And they're like, right away. And I'm like, give it to me now. And they got me in, and it was like, it took like 24 hours. So overnight they just like kept switching me, and then the next day he was ready to go, and the nurse even said, hey, you want to try pushing? And I'm like, yeah, let's try. Even then I was still so excited. I was so happy. I didn't sleep. The nurse asked me, she's like, oh, how's it going? And she's like, have you been able to sleep? And she's like, no. She's like, I'm just very excited because I was so excited my baby's gonna come out. And she's like, you remind me of like when the little girl from Disneyland, from that commercial. They're like, I'm so excited. I'm like, yeah, that's how I felt. And the next morning, then 9 till noon, the nurse had me push, and she said practice pushing, which I was like, okay, let's practice. So I started pushing him out. It was really, really hard. I was like, actually felt like work because I didn't feel anything because I was I had the epidural, so I didn't feel anything. So I'm pushing, so much work, and then he's out. Little baby, and
baby Neo came out.
Yeah, and it was just perfect, and he was really good, and I just like, is he okay? Is he fine? So magic ends.
So how immediately, like how soon since the baby, like Neo's out already?
So
when did it hit you? Like
it happens automatically, because this is how, like, so they sent where I had Neo, it was at this suite at the hospital. They're like, it's this giant room. So shortly after he was born, they're like, okay, we're gonna have to move you. So our suite is gone. We don't have the suite anymore. It's not this huge room with all the space and like light and beautiful like room. They sent us to this like little corner room. Still, I mean, it was our own room, but it just completely changed. The nurses changed. How the nurses treated you changed. Like, it was just like, and I'm in so much pain. They took away the epidural, and I'm like, no. Like, I was like, what do you mean?
You still need it for
I
the
still
pain?
need it. No, they took it away. I got sent to the room. Epidural's gone. I'm swollen. Had a baby. So much pain. I can't walk because I feel wobbly because the epidural is like dozing off. So I'm like shaking, unable to walk. Here's the baby. You can't sleep. They have you watch this video that you need to watch to take care of your baby. No sleep, tired. Watch this video. Cleaning. I won't go into like the bloody like details, but let's just say that like I had a nurse throw a diaper at me.
An adult diaper.
An adult diaper at me when I told her that I was in so much pain, and she just threw it at me because it's like, here you go, you're a mom now, figure it out.
Yeah.
That's how I felt. Like it was just like a slap in the face. You're a mom now, figure it out. You're on your own now.
Did they say anything to Jay? Like anything like, hey, your wife just gave birth, like you should look out for these symptoms, or it's normal if this happens? Like, did they have that conversation with him?
Not really. I got really lucky because my gynecologist, she didn't deliver the baby. It was another one, but she was there and she knew that I had the baby, so she came and visited us and she asked like, hey, if you guys need anything, like I know you have your follow up like the next day, but come over, what have you. Like, so she was really nice about everything, and she talked to us because she was my doctor and she just came over and said hi. So that was a really good experience. I was trying to breastfeed, so I kept getting different nurses help me, and they kept telling me like how to breastfeed, and it just confused the hell out of me because I didn't know what I was doing, and they kept saying, no, this is the right way, no, this is the right way, and I was like,
which one is it?
how do you yeah. They're like, no, this is better, and I was like, but this was working, and I don't know, I was just super confused, and I'm no mom, so I'm just like, what am I supposed to be doing? Like, how am I doing it right? And the nerves came in, everything like just slowly, gradually, like.
So what was like the first red flag? Like, at what point are you like, okay, like something's wrong? Like, this does not feel normal. And I know like
It took time.
Because I feel like it's difficult to like figure out or assess because like you just gave birth, right? So
Yeah.
like obviously you're gonna be in pain, obviously you're gonna be drugged up or whatever. So like how do you balance, like how do you figure out this is normal because I just gave birth versus like, oh no, this is not normal, even though I just gave birth, like this is not normal?
I wasn't there, and it took me a while to get there because I didn't know like how we had a lot of like family, like just immediate family that would come over.
Kind of.
Yeah, they were here and they were helping with the baby. I was just like in a lot of pain and I couldn't do anything, so my mom was here, she stayed with us, and my husband did everything. Like I couldn't, oh yeah, so there it is. So I couldn't do anything, I was in a lot of pain. I had to like change my diaper, like I needed help to go to the restroom. I just had a baby, I can't just hold my baby, I can't just pick up my baby, have the energy to make him a bottle or feed him. Like I needed help every day moving forward after like coming home, and it was so hard because all I wanted was to watch him and to care of him, and I felt useless because here is this baby and you can't do anything because you're in like so much pain, and I just like I felt like I was failing him. I'm like, oh my god, here I am, like this is the first week and I can't do anything, and I just kept telling my husband like I'm not doing anything for him, I'm not doing it. Just like what do you mean? Just like you're like taking care of him, just give birth. And I didn't feel that way at all. I was just like, I'm hopeless, I'm like useless, like I can't do anything. I like, why do I need taking care of? I just had him, I'm supposed to watch him. And it's just this whole like, and I don't know if it's a societal thing that you just feel like you have to do more, you're the mom, you have to do more. So what really knocked it out of the park was that I couldn't breastfeed. So I thought I was breastfeeding him, like I was nursing him.
You're
like,
holding him.
I was holding him. I thought like milk was coming out, blah blah blah. We take him to my sister like to change his diaper, and then I didn't change his diaper that day, and I was like, did he pee? And she's like, no, I didn't see pee. And then my husband said, he's like, I saw little crystals in the diaper. The next day we had our appointment for the pediatrician, he was dehydrated, so I was not nursing him.
So he wasn't eating, essentially. He wasn't getting the nutrients.
Yeah, he was getting nothing. I was dehydrating my child.
Okay.
I was like, this is all I can do. I can't do shit because I can't move. At least I'm nursing him, because my husband's like, oh, you're nursing him. I wasn't nursing him.
So how long did that happen? Like, did that go for a few days?
Well, the next the next day, the doctor's like, no, give him formula. So they gave us a syringe, and so we started giving him a syringe. But it was really frustrating because it just took too long to get all the formula in like a little syringe. Like you're drinking a whole bottle like through a little syringe. It just took forever. So my husband got really frustrated, and they tell you don't use a bottle because you can't nurse if you use a bottle. And I don't even know if that's true or not, but that's what they had told us. So we're trying to do everything right because I really wanted to breastfeed. So my husband's just like, no, let's just dump it. Like, we're not sleeping through the night. Let's just use the bottle. So we did. So then I just felt like horrible. My milk eventually did come out. Like, but it was just at that point I was so debilitated and so like untrusting of my own like production that I gave up on it. I told my husband, I felt defeated. And my husband, I don't want to do it anymore. Like I feel confident like in the amount of formula we're putting in. And during this time we had the formula crisis, which is something else.
That's another thing on top of it.
Yeah. But so all of this, I think your endorphins get lost. Like you crash basically. Like as soon as after you give birth, everything, all the jolly that I had during pregnancy, it just like drops. So your endorphins drop. You are in so much pain. I was medicated. I had like been taking Tylenol because of the pain. So they're like alternate Tylenol with ibuprofen, and I was like, my husband was worried about me because he thought I was super drugged up. I had a panic attack, and I didn't know at the time. I was just like, I haven't eaten. I started shaking. I thought there was like something wrong with my body, so I started freaking out. So my husband had to wait till his dad got home. He watched the baby. So I went to the ER. I went to the emergency. This is like a week after having Neil.
And you're already home. Like there hasn't been any other like issues. Like it's just been like you're struggling with the breastfeeding, and that was as bad as it got in that week. Okay.
Yeah, it was just like the emotions, the ibuprofen and everything like that. It was just my emotions were really low, and I was just freaking out. I was like, we haven't eaten, nothing. Like I'm freaking out. So then I go into the ER, and I'm waiting, and I'm panicking. I'm like, literally, like my body feels like there's something wrong with my body. Like there's like, oh my God, maybe there's stuff still inside. Like maybe my placenta, there's pieces of a placenta. Maybe I have an infection. Like that's how I felt. It felt really real. I felt like something was really wrong with me. So the doctor, like they take me in, they're like, she just had a baby, let's monitor her, let's check everything. They checked everything. There was this doctor, a nurse, and she just like looked at me, she's like, there's nothing wrong with you, like it's all in your head, like there's nothing wrong with you. Like okay, that's fine. I'm like, and I just kept like thinking of what could be wrong with me, and I told my husband, I was like, maybe it's stress, maybe I'm just stressed out, and it's like I'm feeling it in my body. The doctor's like, so you need to go back with your gynecologist. She's like, you're like, we checked everything, we did the ultrasound, we did everything. Oh, they did an ultrasound there. Oh my God. After having a baby and then having them do an ultrasound on you is the worst thing, because I'm like, there is no baby, and all I could think of like, oh my God, my baby is home by himself without his mama.
Yeah.
So then they're like, oh, this took hours, the whole day. We went early, and by the time we left, it was nighttime. That's how long we took at the ER.
So question for you, and I don't mean to interrupt. So, because that what you said right now, like they were doing the ultrasound, and then you're like, oh, the baby's at home without his mom. Is that like part of, I don't know, I guess I don't know how to word it, but like, is it part of that postpartum depression of like you need to be there like at all times because it's a newborn baby? Like, is that like paranoia part of it? Because I feel like now that wouldn't happen. It's kind of like, oh, Neil's at home with his dad or like with his grandpa. Like that fear wouldn't be so bad. So you think that's still part of like those emotions being?
Yeah. Oh yeah, for sure.
Okay.
For sure. It's like you're a new mom, and like you get this whole like as far as I did, I just got this whole attachment. I still do. I still have this attachment.
Yeah, of course. Like it's normal. Like
yeah,
it'll always be there. But I guess
but I couldn't leave his sight.
Like it gave you that paranoia because I feel like
paranoia.
Okay, because exactly. I feel like that's what it was. Because sometimes you would text me and I was like, but he's okay, right? And it would be like a big deal, and I was like, I don't know how to help you because I feel like he's okay. You're getting help, like, but it was deeper than you.
No, it was way deeper. It felt like I was going crazy because I wasn't there with him. They sent me home. The doctor is like, $500 later.
Oh my gosh.
Added to the.
Just to tell you that you were fine.
Yeah. You're perfectly fine. At least maybe this will make you feel better to know that you're fine. Follow up with your gynecologist. Didn't have a psych there. Didn't send me to a psych directly. Didn't do any of that. Like it was all follow up with your gynecologist. You had a baby. Follow up with your gynecologist. Have them figure it out. And the issue was that the referral for the gynecologist did refer me to a doctor, but they called me once and I never called them back, and I couldn't get through. So it was just like this whole mist, like because they were supposed to call me again and they didn't. And it was just I was going through so much for me to be able to even like get an actual like therapist, a psychiatrist. Like I needed a psychiatrist right there and then, and it took so long for me to actually get one because it had to be like my work to do it. It had to be like me to figure it out. And how I even got one is the next day my sister like came over and we're just trying to like help me out and figure it out because my husband's like having my sister's text and Diana text, like everybody's like texting each other, like trying to figure out like how do we help Faly.
But it's because you were after you came back, I feel like it almost got worse because you were like nonstop crying. You couldn't like hold the baby.
Oh yeah. So I got back, and my mom and my sister and my sister's mother-in-law was here. Like they were all watching the baby. Like my husband's like literally like they were just here in the living room, and my husband takes me into the bedroom really fast. He's like, okay, come on. I start panicking, crying, because I went straight into the bedroom and I didn't hold my baby. And I was like, I just got back and I didn't hold my baby? Like, what's wrong with me? Like, and I started shaking. Like I didn't, like, I'm an awful mom. I didn't grab my baby the first, like, coming back from the yard. Like, that should have been, like, my instinct to do. Like, I should have done that.
Yeah, like your first initial, like,
that should have been me. And, like, I didn't think about him. And I didn't think about, but obviously, like, now it's like, oh, with everything you were going through, like, of course, it just makes sense. But at the moment, I was like, oh my God, I can't believe I didn't react. And I'm, like, panicking, crying. Just here, like, crying.
So was Jay, like, or your husband, was he, like,
yeah,
okay?
He was trying to figure it out. Like, you're fine, he's fine. Like, basically, like, reassuring, he's fine. Like, he's fine, he's good, he knows you. Like, so, it was so much reassurance. Like, you're doing everything fine, you're good, you're a good mom, you're there.
But in your brain, you're like, that's not true.
Mm-hmm.
Like, because I feel like that was one of the things when you would, like, when we would talk on the phone or when you would text me, you would tell me what was going on, and I was like, oh, what's the problem? Like, right? Like, I was trying to figure out, but, like, what's wrong? Like, because in my head, I'm thinking, I don't see what you're worried about, but you were so, like, in such paranoia that
yes,
it was like everything was a big deal. And for me, it was hard to understand because I'm like, your husband's there, you're there, the doctor said physically you're okay, baby's there, your family, like, I couldn't understand, I guess, what the actual problem was. But now in retrospect, or after you got help, it was like, well, no, everything was just highlighted. Everything was just like, everything was a problem.
Well,
your paranoia was
yeah,
and everything.
And you have to think about it, like, your endorphins crash, you're crashing, you're not getting sleep. Oh, and that's what happened. I wasn't getting any sleep because I had to feed the baby every 2 hours. So there was no sleep. Mm-hmm. And so think about insomnia, taking care, and then doing the double work because my brain is trying to, like, take care of this baby, and I'm trying to take care of my baby, and with like little resource, like there's no foundation mentally and like physically for me to take care of the baby, but I was thinking I'm not doing enough.
Yeah.
It's crazy to me now. Like it makes so much sense. I was like, oh my god, like how are like all these moms like I need to be there. I need to help them because it's like
it's a lot of work.
It's a lot, and it all falls down to like the self feeling. So my perspective of what postpartum was that you want to hurt the baby. Like that's usually what moms feel, and that does happen. Some moms feel like that paranoia. For me, it was a paranoia. I'm not doing enough. I am not enough. I'm not being there enough. Like
you're not being a mom.
Yes. So I would just cry and cry. Just, anything I did was not enough, and I'm messing this up. Like I can't believe he has me. Like I'm not good enough for him. And so that's what I kept feeling, and my husband kept reassuring me and trying. So what did end up happening was my sister like looked up a place, and we found this emergency place. It's an urgent care for psychiatric. It's downtown, and she took me there. She drove me there, and I was just like, okay, good. Like someone's gonna talk to me. They did. They talked to me, and they gave me medication. So I finally got the help I needed. Because when I did go to my gynecologist, they're like, oh, it's the baby blues. Wait for the referral. They'll call you. You'll talk to someone. I was having panic attacks. I needed help right away. And the thing was that my husband, on top of the baby, like not waking up every 2 hours, I couldn't sleep because I was having panic attacks. I would like fall asleep and then wake up like freaking out, like something's wrong. Like they took over me. Like they literally hijacked my body and like myself. So once they gave me medication, and it's like a sedative they gave me to calm me down. Like that was the best thing they could have done because it finally helped, and I got the treatment that I needed. And then from there, I started doing psychiatric. Like I would get
psychiatric treatment.
Yeah, I got anti-medication, antidepressants. I got like sertraline, I think that's what they gave me, and that helped. And I did that for a while. Within all I found a good therapist, and I still see her to this day. And she works with women, like her focus is moms. So it was perfect. I don't remember how I found her. I think I did a search or something. I remember. But yeah, like finally, and then it's just.
So how long did it take from the moment you got home to like going to this clinic? Like how long was that? Was like about a month maybe?
Yeah.
Was
Yeah.
about a month, right?
Yeah. Oh yeah. Because I had to. So it was like 2 weeks I think from getting the medication. Like the emergency medication that I got from that urgent care, to like a month out, to maybe 2 months, I don't remember. Maybe it was just a month out, but it felt like eternal. Because I remember I told you, like, I have an appointment for psychiatric, but it's gonna be a month.
Yeah.
So it was just me dealing with that urgent
The
care.
reason why I'm asking is because I feel like it's important to, and we'll talk more about this in the next video, but it's important to know the symptoms and like how to get help, because like in your case,
I had to wait.
You had to wait, and in your case, it was more like that feeling of like unworthiness, like you're not being a good mom. But unfortunately, like there's other moms who, like you said, sometimes they actually feel like they want to hurt their baby, and it's not really them, it's like what their body and the hormones are doing. And then there's also women who become completely detached, right? Like they just kind of like act like they didn't even have a baby. It's kind of like, what baby? So I wanted to know, because in case women do have that experience, like maybe try to get help immediately.
Yes.
Not have to wait.
They should have, in my opinion, after you give birth, on top of the baby, like what is it, 2 days after giving birth, you have the baby appointment. You should have a psych appointment. Like, that should be a norm. everyone having a psych appointment.
Yeah.
And then a follow-up psych appointment.
Yeah.
And then a month psych appointment. Like every like all those baby visits that we had,
They should have been for the mom too.
they should have a psych appointment for the mom because it changes so drastically. And,
And the dad.
Yeah, both of them.
Yeah,
both of
because
them.
I feel like a lot of the times it's like, oh, just the mom, but it's
Yeah.
like, no, the dad or the partner
Yeah.
or another relative that's close to the mom should be attending
It's just
those.
be the norm. And then I think what hurt the most was they kept saying that it was the baby blues. Like, oh, we have to wait. They kept saying, we have to wait because it's probably just the baby blues. Your hormones are dropping. It's probably just, and I get it that it might feel soothing for some people to hear that it's nothing to be scared of, but how much it was dismissed, that affected me because I didn't get the help that I needed because it was so dismissed and put down as it's just the baby blues. It's nothing to worry about. When in my case, no, I didn't want to be here. I thought it was useless.
And you were better, Neo was better off without you.
Like, I felt that way.
Yeah.
And sorry, that's not a baby blues. That's like
That's
emergency
really depression, like
that's
suicidal.
depression, suicidal thoughts, like
Yeah.
suicidal ideation, like anything bad. Like, how was I supposed to watch him? Like, take care of him? And like,
Yeah.
and I was on maternity leave, and my husband wasn't. So he had to extend his stay. Like, and thankfully his work was really helpful. Like, and they were very like they let him, but he wasn't getting paid. So we had to like.
That was another stress. To
Like we literally just like ran out. We had savings and we just like cranked them out. And I didn't care because I was like, I know I need you here. Like I can't watch him on my own. And like when he finally did, that was just really scary because I had to like watch him on my own. And thankfully I was in a better place after that. But yeah, no, it's been a lot.
It's been. I feel like it's been a journey like that you weren't expecting, that nobody was expecting, and at least like for me it was really scary because we've always been very open about both of our experiences with depression and anxiety and suicide attempts or ideation, but you don't really, like me personally, I didn't really think it was gonna happen to you because
I didn't think so either.
Because I think even in a previous video we've said like, well, we know what to do, right?
Mm-hmm.
Like I already know my triggers. I already know like, okay, I'm not getting enough sleep. That to me is like a big red flag because that triggers me into getting slowly into a depression. And so I was like, well, Faly already knows like the red flags. Like she already knows, you know, if she starts feeling weird or whatever, to get help. But it happened so fast and it happened so like, it was like heavier this time that it was kind of like, well, I don't even know how to help you because it's a whole different ballpark than what we're used to.
Well, it was I'm not getting the help that I need. Like I went to the ER, I didn't get no help. I went to my gynecologist, I didn't get no help. Like I went to urgent care, they gave me medication and it helped a little, but even when I made the appointment, they're like, okay, well, you have to wait a month out.
Yeah.
Do I have a month? Because I feel like shit. Like,
yeah,
it's like if you're in an emergency situation, like it shouldn't take that long. Like,
and unfortunately, that also happens even with somebody who is depressed. We both experience that.
Yeah.
Like, you don't get help immediately, and I understand sometimes. Yeah, they want you to really process what's going on or make sure that you're actually depressed. But I feel like it's better to give that person all the resources and all the help, and hopefully they don't need them. Versus like, no, this person actually needs them and we're waiting for them to get deeper in the hole.
And when you're experiencing it, like me getting medication isn't gonna help right away. Like it takes the weeks before the medication even kicks in. Like, so it's like you have to think about like, I'm waiting a month and then you're waiting weeks and then you're and then you have to whole process it, and then like I'm still going to therapy. Like I stopped taking medication, but then I'm still going to therapy, and like even that I still have like moments and stuff. But when you're in an emergency situation where like you're feeling like you don't want to be here, that
should be taken serious.
It should be taken seriously. I shouldn't be told like, let's wait and to see if it's baby blues. Like nobody tells you that if you're like you like hurt yourself or something, like let's just wait and see if it's a broken bone.
Yeah.
No, they check to see if you have a broken bone.
Yeah.
Like,
They get you the specialist.
yeah, they're like, oh, let's wait a month out
Yeah.
to see if it's
It's broken.
see if it's broken. We
Yeah.
won't do the X-ray. We're gonna wait a month.
Yeah. See how you feel.
See how you feel. We won't give you medication now. We'll wait a month to see if the pain is really serious. If your
Yeah.
broken bone.
Yeah. No.
So many people have had a broken bone in the past and been fine.
It's just a sprain.
It's just a sprain. Like that pain is nothing.
So
Yeah.
I think I want to talk about, and we're gonna finish this video and do a second one so it's not too long. But I want to talk about your advice to women who are currently going through postpartum depression or who are currently pregnant and are afraid that they might get into postpartum depression, and also the signs that loved ones should look for in a woman who just gave birth, like what kind of help they can get. And I have a few more questions, but I think we're gonna do that for the second video, part 2. So we'll be posting that soon.
Yeah. So for
We'll see.